couple different names. When it was first discovered, it was called navicular disease, and then they started calling it navicular syndrome, and now it's called caudal heel pain or heel pain. I tend to just say heel pain because caudal heel pain just seems kind of redundant to me. The caudal part of the foot is the back half of the foot where the heels are, and so by saying caudal heel pain, you're kind of... Anyway, that's just a dumb little nuance that doesn't matter. I just call it heel pain, and quarter horses seem to be overrepresented in the population of horses that have this disease. And navicular disease is one of those things that's kind of, as we've learned more about it, and with advanced imaging like MRIs and CT scans, it's changed, and that's kind of why the name of it's changed. So at first, veterinarians would do a nerve block that numbed the back of the foot, and the horses would be sound after that. And there's a little bone back there that's called the navicular bone. So the veterinarian could go ahead and take an x-ray of the back half of the foot where that bone is, and sometimes they'd see little lesions on that bone, and so that's kind of where the name navicular disease came from. But then some of them with the same signs and symptoms and predisposition and all that would have the same lameness, and they wouldn't see any lesions on the bone, but they didn't really have any other options or anything else to call it, so it got navicular disease. And now with advanced imaging, they've been able to go in and see a lot more, and they realize that it's not always the navicular bone that's causing the problems, and so that's why the name is kind of changed to just heel pain. It could be caused by a lot of different things, or the tendon sheath, the deep digital flexor tendon. There's little ligaments that hold the navicular bone in place, and anyway, there's a lot of stuff back there, and not that that really matters to what we're doing here, but just that's a little history on navicular disease and what it is, because I feel like it just kind of gets thrown around, and a lot of people don't know exactly what you're talking about when that word gets thrown out there. Something I've also seen is horses will have heel pain from things like thrush, having really bad thrush that really eats away the frog and stuff and makes them sore in the back of their feet, or horses that just haven't been taken care of and get long underrun heels and put pressure where they shouldn't be putting pressure. And I've also seen it from what's called short shoeing, basically just putting too small of a shoe on there, and that causes them to have heel pain. Not necessarily the degenerative disease, navicular disease or heel pain, but they have heel pain from having the wrong size shoe on there. And all that stuff can be corrected, but the kind of the degenerative navicular disease is more what this guy has, and that's the one that tends to be more of a quarter horse thing. And I'm working on getting a hoof specimen so I can actually show you guys what all this looks like inside of the foot, but until now I hope I kind of painted a decent picture of what navicular disease is. And now when you're getting together with all your friends and telling each other cool horse facts, now you can at least smile and nod when people are talking about navicular disease. Okay, since this is a horseshoeing video, why don't we get to the point and actually talk about how to shoe a horse with navicular